Good morning. My name is Dr. Arsha Russell. My topic is analysis of etiological pattern of anterior uveitis in a tertiary case center. There is no financial disclosures. Introduction. Anterior uveitis is the inflammation involving anterior uveal tract. Anterior uveitis is the most common category with a variable prevalence throughout the world and is divided into iritis, anterior-cyclitis and iridocyclitis based on standardization of uveitis nomenclature. Success of treatment depends on prompt diagnosis and timely treatment schedule. The total population prevalence of uveitis varies globally with an estimated prevalence of 730 cases per 1 lakh in India. Acute anterior uveitis is the most common presentation. Acute anterior uveitis due to HLA-associated and other autoimmune disorders, idiopathic, infective, ocular causes, trauma, and masquerade syndromes. Chronic anterior uveitis usually bilateral granulomatous associated with systemic diseases. Common causes are juvenile rheumatoid arthritis, tuberculosis, sarcoidosis, postoperative fused heterochromic iridocyclitis. Aims and objective of the study: aim to study the etiology of anterior uveitis in a tertiary care center. Objectives: to determine the pattern of distribution of the disease, age-wise, gender-wise, acute or chronic type of presentation, unilateral versus bilateral. Materials and methods: study of all cases with anterior uveitis conducted at Uvea Clinic, Department of Ophthalmology. Study design: cross-sectional study. Study period August 2022 to January 2023. Study population: inclusion criteria: all cases of anterior uveitis that presented to the OPD of a hospital. Exclusion criteria: active infective corneal pathologies. After obtaining informed consent from the patient's detailed history regarding the time of onset, progression, and various etiologies associated elicited. After clinical examination, the different cases were subjected to relevant laboratory investigation, a clinical diagnosis made, and appropriate treatment started. These are the clinical photographs of our patient. Results from my study: demography shows 77% of patients were males and 23 were females. More cases were between the age of 30 to 40 years. Bilateral cases are 7%, unilateral 93%. Etiology shows acute anterior uveitis is 84.6% and chronic anterior uveitis is 15.4%. Etiological distribution shows traumatic cases 70%, idiopathic 20%, infective 6%, autoimmune disorders 4%. Postoperative comprises of 5 cases. Causes of traumatic uveitis usually include, in my study include RTA 52%, assault 24%, sports injury 16%, iatrogenic 8%. Anterior uveitis in closed globe injury mainly due to contusion followed by superficial foreign body and lamellar laceration. Discussion: in this study, most common cause of anterior uveitis is traumatic followed by idiopathic, infective, and autoimmune related. Causes of trauma include RTA, assault, sports injury, and postoperative cases. This may because of my institution is a tertiary care center. More cases of traumatic cases were referring here, comparable with the study done by Madhavi KM et al. Conclusion: maximum number of cases were due to trauma, including surgery 70%, idiopathic constitute 20%, infective accounts to 6%, and autoimmune 4%. Anterior uveitis is a vision-threatening disease with a varied causes. In this study, trauma is the common cause of anterior uveitis, followed by idiopathic, infective, and autoimmune related. Thorough history, examination, and investigations are required in each case to facilitate final diagnosis. Prompt treatment ensures good visual outcome. These are the references. Thank you.
So have you compared your results with, you have compared results with only one study?
Yes, sir. Traumatic, etiologic traumatic is more common in my study. So I compared with one study.
So in that study, the trauma was the major culprit behind the anterior uveitis.
Yes,
but I think there are so many studies from northern part of India to the southern part of India and the northern east part of India. Dr. Deepankar Das is having a very good study, then Dr. JB sir is having a fantastic study, then the PGI people are having the study. So I think that those studies are having different etiologies.
Yes, sir. Mainly due to idiopathic, followed by autoimmune and
And have you seen any change, because your study is in the post-COVID era?
yes, sir.
So is there any significant change? Because what is the utility of this study when we are doing the study? What impression it is giving to the clinical fraternity? Whether that change is in that the pattern is different from the pattern we are seeing in the pre-COVID era?
That I don't know, sir. From my study, trauma is the most common cause.
No, that I agree. That trauma is the most common cause. That I agree, totally agree, because any study can has different causes. That's why we call it research, because we are searching again and again. Okay, but what I was pointing out, that is there any significant change in the etiology in the if we compare the pre-COVID era with the post-COVID era? I think we should do. I think it is important, because I have done a study where I have found that in the posterior uveitis per se, if I will say, I found TB more common as an etiological agent than toxoplasma. And one more thing that what I have noticed is that HLA-B27 associated uveitis is on rise. How come I don't understand? Maybe JV sir can tell us better. So thank you.
Thanks, sir.
So thank you so much, all the speakers. They are really very fantastic presentations, giving us insight regarding the management of uveitis. And believe me, it's really a wonderful world of cells and flavor. So thank you so much.